prompted the routine screenings for anxiety that we're hearing that we're going to see when we go for our annual checkup now?
From the USPSTF? Is that what you're asking about?
Correct, yes.
So it was really interesting because I was reading through their recommendation, and they talk a little bit about the epidemiology, about why, and they give some different estimates, actually different from the ones that I have here, but basically there's a lifetime prevalence of anxiety or anxiety disorders in the general population. That's anywhere between 5.1 to 11.9. I know they did an evidence review, and they actually gave some different numbers, and they broke it down by sex. And they also looked into the pregnant and postpartum population. Don't know if you have it there. We can get those numbers to you. But the point is that that's a big percentage of people who will be experiencing some sort of anxiety-related disorder over the course of their lifetime. So why it's important in primary care is, unlike going to your cardiologist or your nephrologist, primary care, we see everybody. We take all comers, and we usually do most of the heavy lifting. So in primary care, it's important for us to be able to identify someone who is having an anxiety-related disorder through our screening mechanisms to then get them to appropriate treatment.
And I think the USPSTF just recently made the recommendation to start screening children and adolescents because there's a high prevalence of anxiety in the children. I think that's gotten worse since COVID started, at least it seems in practice. That's it. And if you have anxiety as a child and you're not treated, you're not going to do as well in school, and you may go on and that anxiety will become worse as you get older and cause, be associated with other conditions, medical conditions.
The recommendation is at age 8 through 65, am I correct?
Yes,
For
children too, unfortunately, in our current society, there is also a correlation between childhood adverse experiences and then later subsequent anxiety. And I think that makes sense to most of us. Unfortunately, we want to take care of our littlest people as best we can.
Okay. Well, it sounds like you're saying, correct me if I'm wrong, that people might be more willing to speak to their family physician who they are familiar with, and it might open the door to a discussion easier than them maybe going to a therapist or somebody they don't know. Would that be correct?
Yes. So in family medicine, we deliver babies and we take care of those babies from birth and follow them the whole way through life, and then as they age into the nursing home. So we take care of them, so we have relationships with them, and we do their well visits, like the babies come in for their well visits, and then children, at least once a year from age 8 on. And routinely, when they come in, we're always asking questions about their well-being and things. And what we do is we screen them for anxiety. So we ask some screening questions for depression, just basic questions that kind of, with depression, we ask 2 questions. And if those end up giving us some positive answers, then we go and we delve a little bit deeper. So our patients are just used to answering standard questions when they come in for their well visits.
Do you have an example of a question or two you would ask somebody for an anxiety screening, or would it depend on the
Do you want to pull up the GAD-7?
So we do use a couple of screening tools which were discussed in the USPSTF recommendation. In this office, pretty much every day, all day, every day, we often use the GAD-7, which has appropriate psychometric properties and has been seen as an appropriate screening tool. So we do use that in this office. They also mentioned a shorter version, which is the GAD-2, that can be used as a screener as well. I saw patients this morning in the context of a comprehensive physical. Even before I get in the room, I do ask that those screeners be administered to the patient in the privacy. They're sitting in the room quietly. They can do it online, or sometimes if they need help, the nurse can assist with that, so that I have access to that information. If they score highly, then obviously when I get in the room, I know that that's an additional problem that I will be addressing during the course of my examination.
And what sorts of questions would be on that screening?
I can answer for the kids. So for the age, there's one inventory. It's called the SCARED, SCARED, the Screen for Child Anxiety-Related Emotional Disorders, and that's for ages 9 to 18. There's another one called the Social Phobia inventory called SPIN. That's for ages 8 to 18. And some of the questions: I'm afraid of people in authority is one. I'm bothered by blushing in front of people. Parties and social events scare me. I avoid talking to people I don't know. Being criticized scares me a lot. Fear of embarrassment causes me to avoid doing things or speaking to people. Sweating in front of people causes me distress. I avoid going to parties, and it goes on and on. So there's quite a few different things.
Do you have any advice for people to know when to seek help for their anxiety versus, we all have everyday stressors, but is there a point where you recommend maybe you need somebody to talk to or some outside help with this?
Sure. So generally we talk about with lots of mental health disorders, it's when the symptoms become overwhelming to the person or to the point that they're impairing their normal function. So like you said, everybody has anxiety or worry. You're rushing to get your kids off here, this wedding next week, or what have you, things that are normal to be worrying about. But it's the magnitude of the worry that's out of proportion to. It's normal to worry, but if it's becoming something that's sort of like a monster that's taking over your life and it's impairing your ability to do your normal activities and it's really weighing on you, that's when you probably need to seek help and get a little bit of assistance.
Mm-hmm. Okay.
And I guess the other thing I wanted to say is there's a lot of overlap symptoms between depression and anxiety, and we've been screening patients for depression for a long time. I think we screened patients starting at the age of 12, so adolescence and on up through adulthood. And those screens are built into our daily flow. Whenever a patient comes in for their well visit, we always ask those screening depression questions. And then if they're positive, we move on to a further depression screen and anxiety screen. And so if any of those are positive, we continue to follow patients too. And the screening for depression has been more standard. The anxiety screening is a newer recommendation. So that's why when you're asking some of these questions, it's hard to answer because again, we haven't used this SCARED or this SPIN questionnaire on the children and adolescents yet, because we haven't actually decided which one we're going to use. And also, if they're positive, then what? We really have to make sure we have the resources. And with COVID, we can't even get our adults in to see counselors in a timely manner. So, because I think back, 10, 15 years ago, we didn't screen patients for depression, but now we absolutely positively do. And that's part of our the implicit, and we provide intraconception care and fourth trimester care to our mothers because we know there's huge amount of depression, anxiety, and we know that the majority of deaths, maternal deaths in the year after childbirth are in white people and Hispanic people are from mental health disorders. A lot of suicide and a lot of accidental drug overdose, but we screen all of our mothers at the first OB visit, and as family doctors, we take care of the moms through pregnancy, and then we deliver the babies. So we take care of moms at the baby's well visit. So we screen moms for depression, at each well baby visit. So we're seeing them very often, and we've picked up quite a bit of, postpartum depression and depression that moms would not have come in themselves and told us about. But when their babies come in, they'll answer the questions, and then we can ask them more and get to the bottom of it.
What kind of difference, if you're diagnosed with anxiety and receive help, what kind of difference do you feel that makes on their quality of life then, as opposed to if it never came to your attention and they weren't receiving help?
I think it makes a huge difference. Like Dr. Anderson, in primary care, we have the advantage of having a long view with our patients compared to like some of the other specialties. And because we sort of treat the family unit, we often see multiple members of the same family. So it's entirely possible that I could have a pregnant patient that initially comes to us and we take them through their pregnancy. They may come to us with a history of anxiety or depression already outstanding, and we know about that. We manage them through their pregnancy, and then of course they turn around and come back to us not only as a patient, but they also bring the baby, and we can kind of keep tabs on them there. So there's that full circle there. We know that pregnancy and during the postpartum period are times of a lot of stress for new moms, understandably, and so there will be sometimes, if you already have a pre-existing history of anxiety or depression, that may be exacerbated, but that's the whole point of us, not only screening, but also keeping tabs on them to say, okay, you had the stress, what's your social support network? You stopped your antidepressant or your anti-anxiety medication. Now should we put you back on it, or do we need to up-titrate the dose or things like that? And I don't think you would get that with any other type of specialty in quite the same way.
Mm-hmm.
Can you speak to the treatment options, or is it just vary from patient to patient? Is it very broad, or are there certain channels that you...
Most of the time with either anxiety or depression, the first thing we try to do is we try to use non-medical treatments as long as it's not severe and disabling anxiety. So referral to a counselor for what we call cognitive behavioral therapy. And oftentimes if that's not alone isn't enough, then we use medication. So a lot of the studies show that the combination of those two are good. You asked about kids. Again, they're common in kids, and what the research shows is that if kids are anxious, a lot of times we see that anxiety manifested in they don't want to go to school. So I just had, and we've been seeing more of this since COVID, since kids were at home learning. Mm-hmm. Now there's that, even from the younger children up through adolescence, they feel more comfortable at home and they have a difficult time going back to school. So even with minimal symptoms, like I just had to write a note. A child has missed 12 days of school so far this school year for minor symptoms, and the mom told me it's really difficult because she just is, not comfortable going to school. She's doing fine. She's doing her work at home, but it's not. Children don't learn as well at home in general as they do in school, when they're missing those things. But if we don't diagnose or find out about the anxiety, then they're not going to achieve the educational, they're not going to do as well in school, mm-hmm. right? And those anxiety disorders in children can turn into other things, like when they're anxious and they don't know how to deal with that, then they might have discipline problems and things like that, and then become, have the anxiety that carries through life. And we have adults that are afraid to come out of their homes and things like that. So it can snowball and get a lot worse.
You kind of answered my next question. Can an early diagnosis prevent more serious issues later on? And it sounds like the answer is
absolutely.
Yes.
And anxiety disorders it's not just one thing. It's kind of a little bit of a spectrum, if you will. Like, you have the people that don't leave their homes. That is very severe. Some people have panic disorder, so they, feel like they're having a heart attack, they're dying. It's like they can't, and then you have people who just have real excessive worry, and that does need to be treated. So it's kind of a big tent, basically. But the idea is if we can try to screen and assess that early, we can hopefully get the person into counseling and possible pharmacological treatment that would help lessen, the impact, and also give them some coping skills how to address it.
Okay.
And I guess I think just in family medicine, we know our patients, we have those relationships, so our patients are very open and willing to tell us most of the time how they're feeling, more than if they go to a new doctor or a specialist or but that they don't know and they don't have that relationship with. So the relationships are really important for patients, because sometimes patients don't want to say, yeah, I've really been feeling this way, and it's not good, and it's interfering with my life.
That was kind of my next question. If sometimes it would be hard to talk about for some people. What advice would you give patients who want to approach their doctor? How should they do it, or if they're nervous about it? Does that make sense? I can rephrase that. You know
Sure.
what I mean? How should a patient approach their doctor with this if the doctor doesn't ask them first, I guess is what does that make sense?
So I think the easiest thing, hopefully this would be a non-issue. But if the physician didn't bring it up, I think usually somewhere in the time that we are meeting and talking with our patients, we do ask them, is there any other concern, or is there anything else that you want to, that I have not already sort of discussed with you today? Many of us go through some sort of standardized review of systems. That's the time to sort of say, oh, I have one other thing, it wasn't part of our initial plan or what have you, but I've been feeling this way for like a couple of months now, or I was feeling bad when this happened, but it's just gotten worse, and I don't know if there's anything you could do, and that opens up the conversation, for us to kind of start working on that problem.
Okay. Was there anything I didn't ask you about anxiety in general you want patients or people who read this or see this to know?
I mean, I guess the part of the reason we're doing this is we want people to know that they are not alone necessarily in feeling that. It is very common. Life, we go through, ages and stages, to borrow the term from a questionnaire that we tend to use sometimes. But things happen to people. There are definitely real life issues that we all struggle with that can kind of kick off these things. But when it's where you can't get over that hump, or you can't seem to get any traction, and it's really impairing and interfering with your ability to move forward, that's where we want you to seek help. And that the doctor's office is really kind of a no shame zone. There are no stupid questions in here. Like, we're just two people chatting, talking, and we're duty bound to do our best to help you. Because mental health, it's a holistic thing. It's not just about a body part. It's about the whole person.
Okay.
Yeah, and that if a patient does feel anxious, that if they can deal with it on their own, that's okay. But oftentimes, patients feel if it is anything mentally related, that they should have control. But sometimes, and anxiety can be related. I guess the other thing that's important is anxiety can be related to an underlying medical condition, such as an overactive or an underactive thyroid condition, or sometimes it's a very profound anemia or low blood count, that they don't have enough blood pumping through their blood vessels, and they just feel awful and wiped out, or sometimes patients will have pain, they'll have other symptoms, and then they worry about those things. So it's better to just talk about it and bring it up and tell the doctor how they feel, and then we can kind of delve into it before it gets to a point where it becomes disabling. So. In family medicine, we're very much into preventive medicine and preventing diseases from progressing and things. So the earlier we can get on things, the better. Get on top of things.